I have an irregular heartbeat. I hear that a lot, actually, pretty much every day in clinical practice. What I want to do in this video is shed some light and provide some education on a specific irregular heartbeat called atrial fibrillation. It's very common in the general population, and it increases with age depending on the study, all the way up into the 20% range or higher depending on the age of the patient. There are a variety of things that can set this up to happen. Obesity, sleep apnea, poorly controlled blood pressure, a variety of things are all involved. What I want to get at is a procedure that can be performed to treat this. There are a variety of medications out there for this and different procedures that can be done, and that's often common the starting point that your doctor is going to recommend. I'm not recommending anything specifically for your instance. This is just for educational purposes only. But I see a fair number of patients who have never been given the option of an EP procedure. And what is an EP procedure? It is an electrical procedure where a specialized type of cardiologist who has years of advanced training and experience goes through a vessel into the heart and finds the abnormal electrical circuit. Most commonly in atrial fibrillation, it's around the pulmonary veins. And what they do is either through a technique using heat or cooling, go in and create a gate, if you will, around these areas where the abnormal impulses arise. And the thought process is that by blocking these signals, it can prevent the bottom part of the heart from fibrillating or contracting very rapidly, which depending on the person can be asymptomatic and not even known. I have many patients and a few family members that have it and have no symptoms at all, at least that they can perceive. And then there's other people that are extremely and acutely aware of it. They find it uncomfortable. It can cause chest discomfort, shortness of breath, fatigue, a variety of other symptoms. So it just is very individual. It's something that you're going to want to explore in detail with your heart doctor. I'll be explaining more next week after my procedure as I go through an EP procedure at the University of Washington, and hopefully this is going to take care of atrial fibrillation for me. If you've seen some of my earlier videos, I had a thoracic aneurysm that was discovered while training for a Spartan race. I had that repaired. It was a bit of an undertaking to get that completed. And now I have AFib post-op, as many people do. Up to 30% of cardiac surgical patients have atrial fibrillation after surgery. The heart essentially doesn't like being messed with. And so there's a variety of things that can be done in the immediate post-surgical phase. I'm 5 years out now, and this little ugly beast, the AFib thing, reared its head. And I've, in consultation with several experts, decided to do a more aggressive, invasive approach to deal with this. Rather than taking extra handful of medication every day for the foreseeable future, I'm being proactive in trying to address this head on. So I'll let you know how it goes, and I'm going to share a link below the video. There's a fantastic physician online. He has a lot of helpful information and resources that are very easy to digest. His name is Dr. Morales, I believe, and he goes by Dr. AFib. So check the link below the video, and take care. Be well. We'll talk to you next week.